I think definitely that kind of patriarchal approach of the physician knows best
Mhm.
is absolutely not the right approach for healthcare. I think hopefully we've proven that in many ways, but I think number one, patients should be responsible for their own care and who gets access to their documents. I
Mhm.
think respecting patient autonomy is the most important thing. But let's be honest, most doctors are too busy, or it's not within
Mhm.
their scope of knowledge, or not within their scope of training. I don't think a doctor necessarily wants to call you every morning and say, hey, did you take your medication this morning?
Right.
Right.
Yeah.
So in that case, the people who are doing that work need access to your chart so they can know you
Mhm.
before they call you.
So does AI know best?
The way I view large language models by themselves is sort of like a mature medical student. So I think of LLMs like they're sort of a third year medical student. They're
Yeah.
kind of like they always sound confident,
Mm.
right? But they have a propensity to they want to please you, right? They can completely make up facts. It very much matters how you ask the question. There's a great study in Nature Medicine just this month showing that like the ability to identify medical conditions drops significantly depending on how you ask. And then, one of the other big issues with them is just that astounding fluency tends to make you believe them. Doesn't mean they're not a great tool. Doesn't mean we shouldn't be using them. But the question is how can we implement like safe and trustworthy AI? How can we make sure that we don't create workflows where there's not a human in the loop? So is that error rate, if it's 10%, is that acceptable? If it's 1%, is that acceptable? Depends on the task.